Now, what I'm about to show you and to teach you is something that I believe every therapist should actually teach their clients, and I believe there are two reasons that cause them not to do so. The first one being, and it's actually pretty common, is that they don't know of it and they don't practice it, which is quite astonishing to me. And the other one being that they want you to come back, because what would their business be if you were able to heal yourself constantly? And with this treatment, I'm able to minimize physiotherapy sessions maybe to once a year, if even, and yeah, it just solves a lot of problems. And what we're talking about is the same thing that the foam rolling is taken care of, which is all the trigger points, all the muscles and tendons that are so stressed, so much under stress, constant use without any relief, without any pause, mentally and physically. And it's so easy. It's very painful, but it's very easy. And the first spot where I want to show you this is the most common one. It's here at the elbow. It's basically, and most usually it's this. You will find, for example, imagine that you have a pain going through your biceps. Maybe on the triceps, maybe the biceps, maybe it goes into your shoulders. Maybe you have something even in your forearm. More often than not, it all is based here, because if you look at this, at the physics of this, if we lift weights, where is the point where all the pressure is landing, all the force is being created? This point right here, the joint here has to endure so much pressure. It's just the physics of this. Sometimes I feel like our body is very illogical, because I feel like there should be something like a tendon here which pulls this direction to support this, because this is just so inefficient, you know? And but of course this is genius. We just need to take care of this. So what we are looking for is, first of all, is the bone, and then the spot where the bone converts into the tendons or the ligaments, and then into the muscle. And if you relax this, like, okay, you want this to be very relaxed, no tension, and you will find a spot and massage it. First of all, you will see something like this, for example. It's very light pressure, and it already hurts so much because it's completely inflamed. And it's always holding on. It's like in constant panic mode. And we need to give it permission to just let go. And as soon as you have found this spot, you will go into it, and it will hurt. And if it hurts, it means that you need to do more of it. It's simply a sign of, yes, you have found me, I need help. Please give me permission to just have a break. And it shouldn't be a pain that you cannot endure. And the way to evaluate this is, you should be able to just have a relaxed face. If you start to do this, it means that you're going too far. It's usually around the 7 or 8 on a scale from 0 to 10 on the pain. So you use the point, take a deep breath. And you will feel after some seconds, maybe after half a minute or a minute, that the pain will decrease. It will go from an 8 to a 7 or a 6, maybe even a 5. And you can re-increase the pressure back to an 8, and it will then furthermore relax. And you can do two methods. The one being constant pressure, and the other one is massage under pressure, right? And you will develop this sense of where to push, where to feel, and around this, you know, because you will feel this logical, okay, what has to work in order for me to lift a weight or to lift myself up? What is it that has to move? And you will, like for me, for example, I always find new spots because we're so complex. It's never just one spot. And you just dig deep, and even if you don't find a spot, it will always be good because you massage something that is under tension. It's just beautiful. For example, this I feel in my fingertips. Beautiful. Yeah. All right. The same applies to the other side. Now you find the bone. Where does the bone go? Into the ligaments and then into the muscle. You will find the spot, apply pressure, and Did you see how my bicep contracted because of the pain? It's a reflex. Yeah? It's normal. Just let go. You know, maybe you're reading a book or watching a movie, listening to music, or just sitting there and just be a person and take care of yourself. And use these moments to, you know, what you're doing here with your muscle is the equivalent of someone, like a good friend or a partner, calming you down, giving you a hug, and giving you permission just for the moment to relax. It's all okay. That's the same thing that we're doing right here, because we're using this a lot, for example, especially for all the pull movements. Here, all the pressure, all the force that's being created, of course, at some point it will flip and say, you know what, I have enough. It's enough. Along the bone, there you will always find spots along the bone, between bone and muscle, that you never thought of. Just give yourself the time and try to find these spots here and there, even if you're not in pain, even if you don't have a problem. This way, you can make sure that you won't have a problem. And just be logical. Okay, what kind of muscle did I use the last days or today? What can I do maybe to give back? All right, for example, the same thing in the shoulders. You know, sometimes we have headaches, neck problems, shoulder problems, and you will just find it's very likely that, for example, your headache comes from shoulder tension, neck tension, in your shoulder blades. Just look there. It's like diving in. You know, where is the bone? Where does it convert to a muscle? And just massage it, or keep holding it. This, for example, hurts a lot right now. Beautiful, beautiful. Just develop this sense for where to look, how to look. Keep massaging yourself. Like I, for example, have become a very good masseuse, I guess, in English, because I always treated myself. I always looked for the spots that were hurting me. For example, if you go here between, like from the shoulders, you have your collarbone, and on this, exactly where the joint of the collarbone, where it's adapted, dig deep inside of this, and just uncover the pain, the tension that is lying beneath constantly. For example, if I wouldn't take care of this from time to time, at some point I would have shoulder problems. It's no question. It's just a matter of time. So I will take care of this and just give back. And as last example, also for the knees. You know, sometimes when we do, for example, something very extreme, like the one-legged squats, sometimes you will feel it here, under your kneecap. Sometimes you will feel all your ligaments And because it's just so much stress. And the beauty of it is that you can take care of it so easily, just by exactly like in your elbow. Find the bone and the gap to the muscle, and just dig deep. Dig deep. This, for example, when I press here on a spot, and it can vary from person to person, and from day to day it can also vary. You just look for it. Look, feel where there's tension, and feel where there's like more pain. Like, for example, you could be applying the same pressure here and here, but here you wouldn't feel anything, but here you would scream on the top of your lungs. And this, for example, I feel it on my kneecap, because this is connected. It's directly connected, because when the quadriceps, when it pulls over my kneecap and creates force. So of course, I will, at some point, my body will not tell me the issue is here. It will tell me, look, there's a pain here. And a good therapist will look for the source. A not so well-educated therapist will just work on the symptoms and maybe move the kneecap, which is good. It has to be flexible and mobile. But at most of the times, this is not the source. Not at the point of pain is where you will find the source of the problem. Dig deep and oh God. And also here on your calves, here on the bone, I will go to the edge of the bone where the bone meets the muscle, and I will dig deep. Oh God. Yeah. And because of the calves are constantly under stress, we're walking, we're jumping, sprinting, they need a lot of care. We always neglect them because they're just, they're just used to being used. But we will learn, that's what I want you to learn, to have this awareness of, you know what, my calves are doing so much for me. Every day I massage some part of my body, maybe the calves, maybe my legs in general, or my shoulders, arms, maybe the chest. But there's always something to be done. And what is more beautiful than taking care of yourself and learning how you can take care of other people too, And maybe something else to show you, which is also very, very, very beneficial. If you have, for example, sometimes you will have problems in your hip flexor, maybe something here in your back, in your lower back. Try to find a spot here. Go deep into your stomach. Relax your abs, because they will at some point they will fight this, because it's unusual to press inside here. Just go deep and find a spot. And for example, when I find the spot here, I will feel it in the middle of my leg, because it's all connected. Yeah, and like that, I was able to treat a lot of pain, many injuries, and luckily I'm pain-free for a lot of time right now. All right, take care of yourself, and if you have any other questions, because it's a complex topic, do not hesitate to ask me. Bye-bye.